Have a good one.
Thank you.
Yeah.
Oh, there's Graham.
Graham, you're here.
Yep. Hello.
Hi, Graham.
Good morning, Graham.
Just had to jump off a pretty cool speed management workshop.
I'm sorry for your loss.
I mean, it was very interesting.
Graham, FYI, Graham, we'll be chatting with each other in the chat under all panelists as needed, okay?
Okay.
Okay.
Okay, so, all right. So folks who are joining us, we'll just give them another couple of seconds here. Good morning, everyone. Let's see my chat. Okay. Looks like we're ready. Okay, it looks like we're still polling. So welcome everyone to our session, Streets for People, how residents can use data to help the city plan slow streets. We have a presentation here, a few of our panelists. I'm Yolanda Takesian with Kittleson Associates. We're going to be hearing from Baltimore City DOT. We have Matthew Hendrickson presenting. Graham Young is on the call with support from Liz Gordon, also with Kittleson, and Carol Kachadorian with Double Tilt and AARP. We want to go ahead and get to the presentation, and I think Liz is going to get us started. So, do we have polling results available? Did we get a sense of how people answer that third question? Okay. People have not answered that third question. So I believe people, can we go back to question number 2? Okay, there we are. People are responding about your interest in slow streets. What are you primarily interested in? Traffic safety is strong at the moment. feels like the Pimlico on Preakness Day. Walking, bicycling, travel space. So we'll give that a few minutes. Some social distancing, community gathering space. So everyone can see that on their screens. So the topic that we're going to talk about is really timely, of course. It's directly related to COVID, and we're all getting used to new ways of doing things, including day to day being now day to week with Zoom as opposed to seeing you all in person. So we'll try to overcome the stiffness here. Baltimore City has been adapting to the possibility for slow streets and different uses on different streets for a long, for the last several years actually. DOTs, so, all right, are we stop sharing results? Very good. What is, let's see, neighborhood livability, okay. So the results of our polling are showing that about half of you are interested in bicycling, walking, traffic safety, and neighborhood livability and stewardship. And the idea of community gathering space and social distancing spaces is coming in a second space. So I have some pictures shown here on the screen that are showing some of the things that the city is doing, and it really reflects what other communities are doing. So we're gonna be focusing on that today. We're very fortuitous because Baltimore City just passed legislation to introduce slow streets, and the city DOT is on a very rapid timeline to begin implementing that. Liz, if you want to go ahead to the next slide. One of those streets in the slide was actually the formal definition of a slow street, but we're going to be learning about what slow streets actually are during this session. We're going to be speaking to okay, so you're not advancing the slide. Okay. We're going to be speaking to have Carol Kachadorian sharing with us what other cities are doing, why this matters. She's been doing a fair amount of research in this area. She works specifically with older adults and in their both mobility and staying healthy. And then we're going to be hearing from the city on the way that Slow Streets has rolled out from other programmatic things that the city has done, and most importantly, how people here can participate both in using the data as well as informing the city on the ways that that you live and what you know about how these places work, which is absolutely essential to this. So if we want to go ahead and move to the next slide. Carol, I'd like you to tell us about what's happening across the country and share.
Sure. I'd be happy to. And I think we're going to talk a little bit about slow streets. If we can go to the next slide, please. So with many in-person activities closing or shifting to online beginning in March, people found that remaining physically active was essential, and I think there was a lot of encouragement to remain active. There was a hesitancy to get out and be with a lot of people, such as using public transit. So people ended up walking and cycling for short trips to the store when they could, travel to work as needed. Next slide, please. It quickly became clear that there wasn't enough space in the public right-of-way for people to be on sidewalks for social distancing. At the same time, fewer motorists traveling meant that, unfortunately, traffic speeds increased, and that created some safety concerns for pedestrians and cyclists. To counter this and provide safe places for walking and bicycling, cities quickly found ways to increase the capacity of sidewalks and trails and bike lanes, but they also found ways to create more, even more spaces for people to walk and bike by closing streets. Streets did remain open for local government activities such as repair and maintenance, emergency services, and for motorists, people that lived on the street to come in. Next slide, please. And also there was an allowance for freight delivery and emergency services. So on the next slide, you can see, if we can go to the next slide, you can see this, the data here ends at the end of May, but you can see some of the interventions or techniques that cities used over time: expanding sidewalks, curb extension, closing streets, shared streets, reducing speeds, and some outdoor dining. And on the next slide, we kind of have a gallery. If you go to the next slide, please. A gallery of what slow streets look like from cities around the country. I'll say that the street selection process varies by city, but there are a couple of common goals all cities have. One of the primary one is equity concerns, especially where there is a high degree of traffic violence. And the cities also want to ensure that there's travel for people of all ages. There are lots of families out, young kids, middle teenagers, and adults. And I will say that there's a lot of work that to stay active, not just for young adults, but for older adults as well. In fact, in spite of early warnings about the vulnerability of older adults, a great number of older adults want to and indeed do remain active. This slide shows the results of a national survey I did of older adults both in early April and for 2 weeks in May to see if they were remaining active, and if so, how they were remaining active. And as you can see, 94 to 96% of older adults were remaining active 3 to 5 days a week. That's a little bit less than half of those. And more than half of those older adults who were remaining active were doing so at the same level or more. Like many of us, older adults were finding ways to be safe through social distancing, but they were also walking, running, taking online classes, gardening, and they were finding creative ways to remain safe, including my favorite comment was that this person was cycling on hilly roads, which he knew there'd be fewer people on. So let's go to the next slide. Talking about cycling has turned out to be a very popular way for people of all ages to get out and be active. I'm sure you've seen family cycling. It may also appear that more older adults are cycling, and that is probably the case. In addition to the survey I did for COVID-19, I'm also working with AARP on a nationwide survey of older adults who cycle. And in that survey, we found that of those that had stopped cycling for about a year, 6% started cycling again because of COVID-19, and 42.7% are cycling more often. Now, we didn't ask about COVID-19, but my guess is that much of that is due to COVID-19. They're getting more exercise. I got an email from a friend whose brother works at a bike shop, and he said they're seeing lots of people who haven't ridden in 10 or 20 years buying a bike. They start with a basic bike, and they find as the pandemic is going on that they're doing more biking, and they're kind of getting even better bikes. So let's go on to the next slide, please. I want to talk a little bit about, so that's kind of an overview. Next slide, we took a look at 5 cities, and New York, Washington, D.C., Raleigh, North Carolina, Seattle, and Oakland. And on the next slide, I'm going to give you some common themes, but then after that, we're going to take a look more closely at Oakland. We kind of consider that the Baltimore of the West Coast. So let's go to the next slide. These are some highlights in terms of the goals, the processes and logistics, and the equity actions of the communities that we looked at. In terms of goals, there are clear goals for safety and health. Equity is a primary goal of cities in determining which streets to close. Again, they want to make sure that delivery and emergency access is there. And most cities also have a target number of miles, and there's a geographic balance to that, whether it's by council district or just the number of miles they feel they can accomplish in a specific period of time. In terms of the process and logistics, you can see that oftentimes they're leveraging their existing active transportation network. They're really using community volunteers and CBOs, community-based organizations, to help. Some communities, such as Oakland and Seattle, are paying a stipend to what they call trusted community members to help with that. They're also coordinating with agencies such as emergency response folks and economic development to make sure that the slow streets support those goals. And they also have to identify staffing and financial resources to keep the slow streets in place and functioning. In terms of equity actions, I can't understate the community engagement that's happening in all of these communities. It's not a one-time thing, it's ongoing. And most communities are adapting programs as they learn more. So with that as another overview, let's talk about Oakland. If we can go to the next slide after that one, please. This is a summary of the Oakland program. They initiated their slow streets in April. Based upon some feedback, which I'll tell you about, they evolved the program to include something called Essential Places in May. And then in June, they initiated another program called Flex Streets. And now they took a pause, and now they're evaluating and planning for going forward. So let's go to the next slide. The city started by taking a look at their neighborhood bike plan. If we could go to the next slide. They used community engagement and consultation from agencies and input from stakeholders to decide. They eliminated with bike plan streets with transit track construction, that whether it was a major roadway and if it provided access to fire stations or hospitals. They also vetted with emergency services. What they discovered was that the streets that were left really weren't working, and I'll tell you why. If we can go to the next one. Basically, they concluded that the bike plan was the wrong model, and they really needed to find a way to identify more relevant streets. What they heard after they implemented a few streets was that there was a great concern for traffic violence, particularly in neighborhoods in East Oakland, and they really hadn't done a lot to take equity considerations. So they have a different tack, which I'm calling Beyond the Bike Plan. What happened was they did a survey. They got feedback on some of the initial streets that they implemented. And while you can't really see the numbers in this chart, if you take a look at the colors in blue, that's the ethnic breakout of populations in the city. And the colors in teal tell you that it was primarily white residents that responded to the survey. And so while they were very happy with the slow streets that had been installed, they discovered that many of the residents in East Oakland in particular said that those streets didn't really satisfy their needs. So if you could go to the next slide. One of the things they learned that there was a high concern about traffic violence. In other words, people felt they weren't safe on these high streets with a lot more traffic and higher speeds. And so roadway crossings remained of concern for them. So working very closely with the community, Oakland initiated something called Slow Streets Essential Places on May 22nd. They started with changes to 5 key intersections, including lane reductions and signage. The intersections were really to respond to the need from residents in those communities to get to places such as with essential services, such as grocery stores, also COVID-19 testing sites. These intersections turns out they're along the city's high injury corridor. And they're also along corridors that have high COVID-19 infection rates where people need to get to care. So these intersections are really important and really respond to what the city needs. In addition to that, on June 19th, the city launched something called a Flex Street program, and this is really to help local businesses. That program eases licenses for businesses, use of public space, with barricades and cones in order to create outdoor space for commerce and for dining, so that social distancing can be maintained. So those are the 2 additional programs that the city launched. If we can go to the next slide. The city is really working to have a virtual citywide engagement and feedback program They have this online survey that people can complete, but they know that they need to do more. They need to do better. They should have, they readily admit they should have had a more robust, a more appropriate engagement program before they put the first flow street in. They also are really working with communities. They ask for volunteers to sign up to help maintain their slow streets. And they're finding ways to be more culturally appropriate in their outreach, both in language and in their outreach techniques. Next slide, please. So this is what their slow street program looks like. About a little over 20 miles of streets, as well as a number of intersections. And if you go to the next slide, you can see that this is the East Oakland area. So that's really important. They've been responsive to that. So what's next for the city? Well, they're going back to they're doing an evaluation this month and planning for going forward. They're taking another look at the bike plan, but this time they're also looking at the pedestrian master plan to help identify additional streets to slow, essential places as well. They're revamping, as I said, they're revamping their community engagement, not just for what's happening now, but they're really taking a long view, assuming that restrictions are going to be in place for a while, and also planning for what will happen when restrictions are lifted, really trying to address the need for equity and traffic violence concerns. And that's it. Thank you very much.
Thank you, Carol. Go ahead to the next slide. So we're applying a lot of this thinking here in Baltimore. We're going to move to Baltimore now, and with that, if folks want to respond in the chat, I'm curious as to whether or not you're actually working with a community organization on the new Slow Streets applications. We're going to learn about those in this next section. I'm going to highlight here that there's an interesting new initiative that's been underway for a bit, and I think the website is going live today. Robin Lewis on this call has helped to organize residents of the area between Broadway and Highland Street, north of Patterson Park, and we're looking at some census data that talks a little bit about car ownership and the age of residents there. And I think what is really striking is when you start to pull this demographic data into the conversation, you see some real needs arise. About a little less than half of that area does not have access to a car in their household, and the darker brown areas are between 60 and 80% of the households there are not using a private vehicle in their household. So this type of effort, organizing, is something I think that the city is pretty excited about in general. Matthew's going to speak to what the city is doing in response to the legislation, how it evolved, what the program actually stands for. And I want to introduce Matthew by way of saying I think he's come to the right place at the right time. He's only been in Baltimore about a year. He came to us from New Orleans, having been policy director of a transit advocacy group called Ride New Orleans, and has participated both at the state and the city level on Complete Streets. So with that, Matthew, would you can advance to the next slide? Move it forward.
Thank you, Yolanda. I really appreciate that introduction, and very excited to be here in Baltimore and take this work forward. As you say, it's the right time, and just kind of, looking at our best practices and different programs across the country that Carol has shared really aligns with not only the goals that and the mission that we have for Baltimore DOT, but also for the people on this call. As you've seen the results coming in as far as the need for traffic calming, the interest in walking and biking facilities, and what that means, all of these modes working together to really provide the quality of life and livability, for our neighborhoods. And that's really our mission. And so really the ask here today is, how are we evaluating this? How can we take these programs forward? What are the kind of data points that can really inform our decision-making to be successful, to reach those goals. Please, next slide, Priya. And then usually I'll just say okay when I'm done, but definitely we'll prompt. Thank you for that support on the back end. But certainly during the pandemic, we realized that there was a need for those social distancing measures. We just want to reiterate and support those public health needs and continue to not only provide the infrastructure for the social distancing with including, the slow streets additional space, but also really addressing, the traffic safety issues, especially as things have changed, where traffic volumes are down, but speeding is up. Our crash rate percentages are staying the same despite those lower volumes. So we're seeing basically more crashes with the people using these roads. And again, the type of crashes with those speeds can be incredibly violent. So how can we, avoid those conflicts and again, provide space that's needed? Next slide. So we started a pilot program at the city, really focusing in park spaces, because as we analyze kind of Google metrics and traffic data, we were seeing a huge spike in use. And as I'm sure you all out there can attest to, exercise is still essential, certainly essential not only for, physical health, but also mental health. And so it was just a natural place where people felt safe and also where they could, go and exercise. Exploring Baltimore, I've realized what great amenities we have in the city and around the region. And so people are taking advantage of that. So we started, at Lake Montebello in Druid Hill Park. You can see a couple examples of this. And then, we kind of moved on into a more formal program through the city legislation, which I'll talk about in just a second. Okay. We also did an area in Patterson Park on Linwood Avenue, and as well as kind of the adjacent streets there at Lombard and Pratt. I just wanted to kind of talk about how our program, one, really focused within park space, and especially this one where we had quite a bit of neighborhood association support and really an appetite. They came to us and asked us for a similar type of treatment after seeing the work done in Lake Montebello and Druid Hill Park. We want to ensure that park access and ensure residential access, but we're really trying to deter that cut through traffic. These aren't road closures. We're calling them soft closures per se, so that we can still have that local access for residents. Parking is not reduced, and that you can still have, deliveries and emergency vehicle access. However, just being mindful that this is a shared space and making sure that, people are being safe, driving slow, being mindful of other modes, cars, people walking, biking, etc. Just a couple images here from Linwood. Next slide. And so, we're taking our time, kind of making sure that we were, getting that support from community, really instituting, or really coordinating with our partners, especially at parks, with residents, and then we had City Council, I think, wanted to see more of this, and that there was a greater appetite to implement these slow streets across the city. And it moved very quickly starting in May. They passed city legislation that mandates DOT to implement 25 miles of slow streets, and that each council district would receive a minimum of 1 mile and no more than 15%. So that'd be about 3.7 miles. So of the 14 districts in Baltimore, we're looking at, on average, about 1.5 to 2 miles. And as you can kind of see within the legislation, they also said without significant agency resources, what is difficult within a kind of a 2-week window. So once that bill passed, 2 weeks for implementation. So that officially started on July 13th. It was not signed by the mayor, but went into effect at that time after the third council meeting. And so we are now in the process of collecting nominations and implementing these 25 miles. So what does that look like? So definitely we need support as far as that community outreach and community support. We have, as you can see here, we're doing our best to make this as simple and efficient rollout as possible. We have kind of an in-house prototype that you can see here below. simple construction of 2x4s, and that's, with reflective material and signage. There will be additional signage as far as what slow streets are and what the program entails and how you can find out more information. And again, we have, go ahead and go to the next slide. We have our own recommendations, and that's what the image that you can see on your right. We've provided about, I think, 65 miles of recommendations. So obviously there are decisions to be made where these locations will be implemented. And we're looking really to avoid, major streets, major arterials with the type of barriers that we're using. High speed, high volumes, so no truck routes, no bus routes. We're already looking for those more, residential corridors that do connect to parks, and, more neighborhood streets, as well as, where there may be cut through traffic, and looking at those long stretches and longer corridors that can provide more access through different neighborhoods. And again, for a simple rollout, and improving access through those neighborhoods and great places. And again, the decision-making process, we have our recommendations, and then we have opened the nominations up for slow streets to the public. And so we have our website up. We are accepting those nominations. So they are rolling in consistently. I think we're close to 200 nominations so far. And we're evaluating that with council sponsorship. So we are sharing this information, our recommendations, with the council members, and as well as the nominations that are coming in, and really working to prioritize with the council office. And Carol mentioned, again, the difficulties with kind of rolling this out equitably. And through the conversations that we've had and the prioritization process, I think that councils and DOT evaluating all of these streets, there's been a mindfulness of that. We know that it's not going to be perfect, and we think that there's a really great opportunity within our evaluation process, which will begin in 30 days once we implement all 25 miles. And we're hoping to get that out as soon as possible. And in a similar function to the map that you see here, once a street is implemented, it will go live on our website with a mapping tool that you can click on it and provide feedback. Next slide. And there are other sources of data. And again, the end of the conversation, we want you to inform us what we should be looking for. But this is kind of our road criteria, performance monitoring system, basically the functionality of your road system. Here in Linwood, this is one of the, I would say, higher volume level streets that we'll be implementing. But we also had that community support. And so we're looking at multiple data points. And, I think really interesting as far as the evaluation phase is, could this shift with, some more permanent infrastructure and kind of reclassification? So something to think about as we take the conversation forward. Next, please. We are live with the program, so you can go to our website. If you just search Baltimore Slow Streets Program, we'll have more information and hopefully answer your questions. We also have a nomination form link to that website, next page. And so we are accepting those nominations now. We're evaluating it, reviewing them to see if they meet our safety criteria with what I kind of outlined earlier, and working with the council to implement them within this time frame. So it's moving very quickly, and we're going to continue to do our best to implement. And again, this is kind of our I guess, decision-making matrix as far as our recommendations, the nominations that are coming in, making sure that they're reviewed and safe, and then we can install. Okay, next. And so again, I guess what happens next, right? And kind of looking, to the different data points that will inform us as far as, is this successful? Looking at the ridership, really getting feedback from folks. What are the best way to reach out, evaluate, making it as easy as possible for people to provide that feedback, making sure that it reaches as many folks as possible. And again, certainly, lean on this group to kind of hear more from you. These are kind of the things that we've outlined and are looking to evaluate when we get into that process. I think we have some good points here. But again, this is a great group to kind of help inform that process. And then next, please. And just an example of some data that we are using. We have a really great scooter program that measures how scooters are used, kind of their trip. Each trip is measured and compiled into our database. You can see origin and destinations. And so you can really see how people are using city streets and how they're traveling. And it can really inform how we're going to implement future infrastructure. Next, please. For example, we provided a two-way cycle track on Covington Street, just off of Key Highway. Before it was implemented, the top graph here, you can see the parallel streets as far as how people are riding. And then the second graph, you can see a huge shift as far as once that infrastructure was implemented. That blue graph now has really gone up as far as, and kind of the parallel streets are now going to where that infrastructure, where they feel safe. And so this is a really good indicator that we made the right connection, and that now that they have that infrastructure, that people are using it to get to where they need to go within that same neighborhood. And again, I will just kind of turn it over to Yolanda as far as how to look towards this for the future. And again, certainly appreciate your feedback and looking to reach those goals as we discussed, as far as not just traffic calming, walking and biking infrastructure, but really kind of the future of Baltimore, access and opportunity, and quality of life. Thanks so much.
Thank you, Matthew. So I noticed that people are adding questions to the chat. We'll open it up here in a couple of minutes for live questions, but I wanted to, I'm not sure how many folks on the call saw the New York Times this weekend, and as we're having conversations about what to do about schools reopening, this image was there during the previous pandemic of children being educated outdoors. And if you go to the next slide, and then the new fabulous NACTO guide, the National Association of City Transportation Officials, came out with their response and recovery about the many new things that one can do with streets going forward. And they had school streets, which show in the foreground the classroom space, the play space, and the drop-off parents walking their children to school. So there are many ways that streets can change. If we did provide the link for it, it's a fascinating piece of work that gives a good definition, in fact, of slow streets themselves, as well as introduces the other types of streets that people are thinking about. So we see this program as opening up an opportunity to sort of begin to contribute to the ways that we want to improve not just travel in the city, of course, which is streets is a primary function, but look at the function of streets in ways that support community health, both physical and the community more broadly speaking. So I'd like to turn the conversation over to Liz Gordon, who's with Kittleson Associates. She works with Matthew and Graham on a pretty daily basis, is helping to roll out the programs, has been involved in a couple of these. Did folks have ideas about which of these streets are in fact slow streets? Anybody want to speak to that either in the chat? Okay, so I'm going to turn it over to Liz. And Liz, if you want to go back to the questions and tell us which of these streets, first of all, would be technically considered a slow street, and where things stand, either Matthew or Liz.
Well, I'll let Matthew speak to which, if any, are officially part of this program. And I think the reason to have these images is to just show kind of the array of ways that the city as an entity and also residents are sort of rethinking use of space. So Matthew, if you want to talk to that real quick.
Yeah, there's a couple things that I want to indicate. We have two distinct programs currently at DOT. One is an outdoor dining relief program. This is also a shared street, and we're operating within the kind of similar style of treatments. Some of these treatments for the outdoor dining program are full-on road closures, not what will be implemented within this phase of the Slow Streets program. Again, looking at those more residential streets and still maintaining that local access. And also just the nature of our barriers, they are temporary. So these are temporary measures. I really want people to understand that these aren't permanent solutions. And that's where the kind of evaluation process, I think, really can help us inform future projects. So, what we're having now may not necessarily be, what will be in the future. And again, but it will help us inform what type of traffic calming benefits can really, support the neighborhood's needs. And you can see the different array and style, with kind of, the street closures, more permanent barriers, people activating the space, being in the space, recognizing that it is a shared space, the kind of narrow roadways, and really just here on the big jump, the actual separation, the physical barriers that can create more comfort, even though we're looking at high speeds there. And so there are just different types of treatments for different roadways to make them feel safe for all ages and all abilities.
Okay, so with our remaining time, we're essentially going to be trying to answer some of the questions that were on a previous slide. So I may ask to go back to that question slide. That works great. And I'm just going to be doing my best to facilitate this sort of between the chat and us speaking back to you. I'm going to try to capture the questions that are already in the chat before I then pose some of these questions that are on this slide, the first of which may require bouncing back a couple of slides to sort of support. And so since there are so many attendees, I really do think that using the little chat option to send to all panelists and all attendees your question or your answers to question as we go is the best way. And since I know that the people accessing this via Facebook may not have access to the Zoom chat, I will be kind of reading these things aloud, so apologies if it's a little redundant. So first I'm going to ask a question from Jed, which is there a prioritization scheme for pedestrian recall implementation? So pedestrian recall would mean that pedestrians don't have to press the button to get crossings. For example, crossings into Druid Hill Park or the Herring Run Trail at Bel Air still require a push button to cross. And so this is a suggestion to prioritize around parks, groceries, testing sites, kind of similar to the Oakland Essential Places program, and notable that having people who may be positive for COVID touching shared surfaces is not ideal around testing sites. So is there a panelist who wants to speak to that?
I can speak to that, Liz. DOT has explored this, and we're continuing to vet this. The problem with our system is that we don't really have an updated signal system, and so the ones that are not automated. So as you said, this kind of recall where you would not ever have to touch a push button. We definitely want to get away from that. We want these things to be automatic. And making sure that we're prioritizing pedestrians, that there's an equal balance for signal phasing at these types of intersections. Where we're exploring, and we've done evaluations around these sites that Jed has noted, especially right now during the pandemic, the food distribution sites, hospitals, clinics, pharmacies, park space. These are just critical areas right now, and more critical than they've ever been. And so making sure that we have safe access and safe pathways there is a priority for us. But we can't just flip a switch to be able to do that, just because our system is really so out of date. So we need to look towards the future as far as how we can update our entire system. And that's just going to take time and more resources. For us to go out to the sites that don't have those, it just takes, people power. And, we're still working through that. And we're doing our best. We can't just do this overnight, but that's kind of where we're at within that push button issue.
I'm gonna go ahead, Graham.
Just to add to that, I think, the push button issue is definitely one of the issues with the traffic signals, but I think the main issue is that we are running traffic signal timing plans that were developed for heavy traffic volumes. So not only did they prioritize the movement of, vehicular traffic then, now when the traffic volumes have significantly dropped, sure, it would be great to not have to push a pedestrian push button, but also it would be great to not have to wait 2 minutes just to cross the road safely. So, it's a real challenge because everything's in a coordinated network. So to change, say, the cycle lengths, make signals just shorter cycles, you really have to focus on a large area, and it becomes just a logistical issue, but it's definitely a problem we're aware of.
Thanks, Graham. For the sake of time, I'm going to turn us to the discussion of data and data sources. So on a previous slide, we did show some of the data types and data sources that we're thinking of using to evaluate projects after they go in. And so this is sort of a two-part question that I would love to get answers to in the chat, and I'll read them out for the benefit of the people watching on Facebook. But the question is, are there other data sources and data types that you can think of that should be used to evaluate projects that are installed? And then also, as you and your peers in this discussion are thinking through streets in your own neighborhood to nominate, what data types are most important to you? Are you really thinking through? So I would love to hear answers to those two kind of data questions in the chat. What's missing from this list? What's most important in this list? And what are you thinking of as you and your neighbors are nominating streets? So just to read sort of the list for you to react to, for measuring the number of users on an installed facility, we're thinking Strava data is usable, although it's a flawed source. Scooter data, we can get to see how many scooters use a given route. And then observations, and we would really love thoughts on how to prioritize those because they're not feasible for every installation. We heard some of the issues with online surveys in Oakland. Would be interested to hear thoughts to augment that approach. There, as was mentioned, there is going to be an upvote and downvote map. And then is there a desire for a volunteer facility ambassador program? You saw that volunteer sign up sheet for Oakland. Is that something that would be worth the level of coordination that it would take? And then we do want to learn if there are issues that could be addressed in changes in the design. And that would probably be through select intercept surveys, the online survey, possibly door hangers, or outreach to community listservs or through council members. And then to learn, and then we have a pretty limited arsenal of publicly available data to evaluate how installations have changed things for motor vehicle users. The possibility would be parking audits, perhaps done by community groups if there are parking concerns that want to be brought to light, and then the Google API to show if there are delay changes. but the data available for that is pretty limited. So as this is Baltimore Data Week, would love to hear feedback on that. While people are populating that feedback into the chat, and I will read it as we get it, if you could go back a couple of slides to a screenshot of a map with blue lines on it, that this is the functional classification map. And this is just an example of a publicly available data source that can give community members some of the information that DOT is thinking through, right? So if you go, the link, the source is at the bottom, and can be dropped in the chat. That can help you figure out if your street that you're thinking of nominating is a collector or an arterial, or whatever the case may be, because as Matthew was saying, DOT is trying to focus on local streets. So we did get some discussion in the chat. Jed says, would it be possible to partner with existing community leaders and give micro grants for programming, implementation, and evaluation from trusted community members and partners? For example, funding neighborhood groups for Play Street implementation, School Street implementation, or other things that could be accomplished on slow streets. Thank you, Graham, for the, so there have been 2 links to functional classification dropped into the chat. One a little easier to view than the other. If we can go back to the question slide, I think the comment about trusted partners for other uses of slow streets does sort of move us to the possibilities that the program could open up in the future. Because I think we do understand that the way we use public space is very in flux right now due to COVID-19 and all of the changes that we're having to make. And so I would be really interested to hear in the chat what people think are the possibilities of making those changes in a way that is effective and benefits people, and also important considerations. So Jed did mention school streets, which was one of the street types proposed in the NACDO guide. But thoughts for other uses of public space, and also considerations to do that equitably. Are any of the panelists mulling over thoughts on the possibilities for this program in the future?
I'm definitely mulling, Liz. I am thinking about this as kind of how we take this forward. And, it's been interesting to see all the different nominations coming in, and kind of, with our criteria, balancing that out with our recommendations. And it actually, the notes and the comments, from the public have been really informative. And just kind of hearing the different issues, and you realize, again, what we just saw within the polling, within those goals, the real need for traffic calming, and really responding to the built environment. And I think even to Graham's point about our signal system is similar to our roadway system. Our roads were built for a different time, for different traffic volumes, as well as, just how they were used. But we also have to acknowledge the kind of history of how things were built, with, the built environment is a function of segregation and redlining. And, this is very intentional, and has been built up over time. And we need to be very intentional and thoughtful about how we can, change that. So to kind of hear the different examples that have been coming in just on the local streets, but also just recognize kind of how we have, some very high speed highway type streets that really, disconnect neighborhoods, and those intersections are incredibly dangerous. And so we may have, some very great, residential areas that you can bike and walk in and around that neighborhood, but getting out of that neighborhood is a challenge. And so our goal is to really make it safe. And it's just really great to see, that I think most people have those same goals and want that same quality of life, throughout the city. And so, it's, our mission is to, implement the things that can do that. So that's our goals within our bike program. I think that's our goals with DOT. It really, I think this process can really show us what is needed, to adapt to that and to provide that, to provide those community needs within our infrastructure.
So we are closing in on our time. And so what I think I'm going to do with the remaining time is the panelists via the chat have received some comments, which I'm going to read for the record and panelists can respond to briefly. But before that, there was a theme in the commenting, which was, are there low-cost traffic calming and sort of community-driven solutions that people should particularly be thinking about?
So, Liz, I guess I'll try to address that, and then also I wanted to talk to what possibilities, do we see this program opening up
Sure.
for the future?
Thank you.
Because this program is very, quick implementation, limited public outreach, limited resources. It's focused on these soft closures, road closed, local traffic only, where you can just drive around the barricade. If we had the time to do a lot of planning and figure out logistics, get the community buy-in, these could be real hard closures. They could be simply just flex posts blocking off a street so that people biking, people walking can get through, emergency vehicles could get through, but you would not have any through traffic. You would have to, it would be basically dead ending a number of streets for the purpose of improved walkability and bikeability on those corridors. So I think this program sort of opens up the potential for the future of, if we have a real successful slow street, maybe we can look at, well, what if we do alternating one-way patterns so that you don't get any through traffic? What if we just literally just dead end some of these streets? I think there's just some benefit, that we might see from that. In terms of low cost, like what can communities do? We're looking for community partners in this program. Similar to other cities, we really want people to look after these installations, maybe beautify them, sort of own it as part of, a community amenity. I don't think we're outright saying put things in the road for traffic calming, but it's sort of the vibe we're going towards.
In the last 2 minutes that we have, I'll just take the prerogative of moderator and say, as a resident, more than as a transportation professional, it's really encouraging to see this sort of relationship and recognizing that the DOT doesn't do any of this on its own. The fact that the program is online, people can submit their ideas and hopefully hear about how these streets are performing through the same medium or other ways. The fact that I'd see the names, a lot of the names that are here on the list are participating in their community organizations and are in fact leaders and can be informers of how this works. I see a lot of synergy here and better communication that can help to transform the city with these resources. It's really important to be able to move about the city, but there's a third of the space is in the public right of way. So there's a lot that we can do to make it work better for us as community members. So
I do want to note that there were some comments that came directly to just the panelists, not all panelists and the attendees, and we didn't get to all of those. But I do want those of you who submitted those to know that we're seeing them, we're reading them, we're taking them seriously. We're just constrained by time.
So we want to thank everyone for joining today. And keep an eye out. I think, Robin, you will be providing all the links to all the data and information sources here in the presentation. And if we can make the comments available as well, the session has been recorded, so people will be able to refer back to it and hold Graham to the things he said to us, and get, receive support from the community members that participated. So thank you very much, everyone.
And before we end, I'd like to remind everyone participating to fill in the BENIA survey. You should find the link in the chat, survey or evaluation of this session. We'd love your feedback. So thank you. You should see that in the chat. The link to the evaluation in the chat.
Excellent. All right.
Thanks, everybody.